Uterine fibroid is one of the most common pathology encountered in the female world, and it brings women to the hospitals or to the doctors many times a year. What are fibroids? Fibroids are benign tumors of the muscle of the uterus. Usually one cell or muscular cell of the wall of the uterus starts to grow, and it causes those benign tumors. Why do we talk about them? Because they are very common. In the fourth and fifth decade, fibroids can be present approximately 40 to 50%. And they are the most common reason for hysterectomy in females. How do they present? Basically, depending on the position of the fibroid in the muscle of the uterus, symptoms follow. If you have a fibroid sitting submucosally, which is inside of the uterine cavity, usually they do present with bleeding. If you have fibroid that is sitting subserosally, which is outside the muscle of the uterus, basically the outside of the uterus, they don't cause symptoms unless they're big in size. When they become big in size, they can push on the organs around the uterus and cause pressure symptoms. While if you have fibroids inside of the muscle of the uterus, which we call intramural fibroid, those, depending on the size and the position in the uterus, they can cause either bleeding or pressure. Fibroids can be one and can be as many as 20, 25. And they can be like 1 centimeter in size, and they can also be around 25 centimeter in size. So the shape, the number, the position change, and based on the shape, number, and position, the symptoms change. The most common symptom of fibroids usually is no symptoms. So you can come to the gynecologist, he's doing the checkup and he's doing the ultrasound, and he'll find a fibroid and you don't have any symptoms. At that point, really, you don't have to do nothing. And then when the fibroids are symptomatic, at that point you have to take care of them and treatment. For the treatment of the uterine fibroid, you can go from no treatment if they are asymptomatic, you have medical treatment, and you have obviously surgical treatment. Fibroids are hormonally dependent tumors. So basically, if you just wait on them, if they don't have too much symptoms and you get to menopause, they will shrink by themselves when the hormones drop in the female body. So basically, if we want to treat medically a fibroid, we have to put the female in a pseudo-menopausal state. So if we can give the patient medication that can put her in that state, the fibroid would shrink. And those medications usually are most of the time something called GnRH analogs, which are hormone shots that you can take to stop the axis that secrete the estrogen and the progesterone in the body, and that makes usually the fibroid shrink. Treating fibroids with birth control pills or progesterone pills is okay, and it's just like a temporary treatment to stop the bleeding. You cannot use that for a long period of time. One other hormonal treatment that can help with shrinking the fibroid is called progesterone IUD, which is basically an intrauterine device that you put inside of the cavity. It releases local progesterone and controls the bleeding from the fibroid. Those are mainly the medical treatment that we can use for fibroid. If we don't take it one step ahead, there is something called uterine artery embolization, and this is when we close the vessels that is feeding the fibroid by certain particles in the radiology suite. And this can sometimes be done for people that don't want to have surgery, some people that are not basically fit for surgery. And the last treatment for fibroid is surgery. And the surgery can go from hysteroscopic surgery to laparoscopic surgery to open surgery. And this is all, again, due to the position of the fibroids and to the number of the fibroids. Hysteroscopic myomectomy is going through the uterine cavity to cut the fibroid out. Laparoscopic myomectomy is doing a laparoscopic surgery through small holes on the belly to go and cut the fibroids out. And open surgery is when you put the bigger incision on the belly and go inside and cut the fibroids out. So this is mainly the mainstay of treatment and management of fibroids. A couple of things just to mention before we end up on the fibroids. Fibroids sometimes can cause infertility if they are inside of the cavity, or sometimes they are big and impinging on the cavity. And in some rare instances, fibroid degenerate into cancer. It's very rare, but it can happen. And a fibroid that is too big with necrosis and pain sometimes might degenerate into something called leiomyosarcoma. This happens in less than 1% of the cases, but it's something that you need to keep in the back of your mind when you have big fibroids that are necrotic. If a patient does not want to do a myomectomy and she's done with her family growing and she doesn't want to have any more kids, You can do a hysterectomy, you can do it laparoscopic, or you can do it open hysterectomy just to remove the whole uterus, and this way the whole uterus and the fibroids are out.